you've come to the point in your life where you decided to go for TMS treatment.
Mm-hmm.
What specifically made Smart TMS stand out as the chosen clinic? Because there are other providers. What made you choose Smart TMS?
What made me choose it was really speaking on the phone. So I contacted the Smart TMS clinic and I booked in a Skype consultation. And I think what really sealed the deal or made me sure that I was going to get the best treatment was by speaking to Dr Neal on Skype. And that was incredibly reassuring and really, you know, I knew I'd made the right decision then. But it took, I think, actually speaking to and seeing Dr Neal on Skype and him having answer a lot of the questions that I had or researched.
What is it about Dr Neal? You're full of praise for Dr Neal. What's it that he's done for you throughout the course that you'd recommend to others? What is it that makes him so special?
What makes Dr Neal stand out as a professional is that I felt like I was well supported the whole time through treatment. From the Skype consultation that I had, he, you know, was empathetic, understood where I was coming from, understood the illness that I'd suffered from for so long, and really understood how the TMS works as well, and also gave me an indication as to what other patients had, what results other patients he had seen from other patients. Other than that, I mean, from then on, we had regular consultations. He was always there, available to speak to on the phone or through Skype with any questions. The team worked quite closely with Dr Neal in that any changes that I felt like I'd had, they'd immediately relay that back to him, which I thought was fantastic.
What was the overall team vibe in terms of the care that they gave you throughout your treatment?
It was a huge part of the treatment was connecting with these technicians daily, basically, seeing them every day and them noticing kind of different changes. And me, what I thought was really, really helpful was I was able to just talk openly with them about what had happened before, the changes I was going through now, and what I was going to do in the future. And it was just fantastic to. And I also heard a lot about they were very, very open, so I heard a lot about their experiences of going away or working or things. So we had a really good relationship by the end. And I think that with the treatment is hugely important that you connect with the people that are carrying it through, because you are seeing them every day. I feel like it's really important that you're doing it with someone who's so open and understanding, really, and there was no judgment whatsoever as me as a patient.
So when you said the end there, in terms of the end of your treatment, so what is life like now after Smart TMS treatment?
After Smart TMS treatment, life looks very good. The symptoms of depression that I had for 10 years have completely reversed. I feel like there is none left, no even residual symptoms. So opportunities are easy to see now. It's easy to have conversations with people. It was quite fluid and easy to have now. My memory is kind of been restored, I would say. My perspective on life is, as the clarity that TMS has given, I think is probably my most treasured and most grateful things that have come back. I couldn't have done it. I couldn't have continued life on without TMS. I feel like TMS is the most effective solution to this problem that I've had for 10 years. I cannot see another alternative to it, and I just simply had to do it in order to get back to normal, in order to not waste any more time, because I see time is very valuable now.
In terms of a potential patient looking from the outside shop window, what would you say Smart TMS feels like? What was the experience in terms of using the machine and coming in for treatment? What does Smart TMS treatment feel?
Smart TMS treatment feels like a tapping on the side of your head, basically, depending on where on your head that it's being used to treat what condition. It's quite uncomfortable at first, I would say, just purely because you're not used to it. That comes a lot easier with the sessions that you do. By the third week, it was similar to sort of white noise, in that it's such a light tapping that I didn't really feel anything.
So for you personally, was there any side effects from the TMS treatment?
The side effects of the Smart TMS treatment were minimal, really, I would say. I had slight tension in the muscles in my forehead. Nothing significant. Slight, almost just a slight residual headache, but not for prolonged periods of time. Over a month now since I've had the treatment, and there's been nothing that I can see that's been in any way a side effect.
Great.
Yeah.
So in terms of looking in the future and going forward, what 3 points would you say to any potential patient, no matter what condition, that are potentially considering Smart TMS?
Considering Smart TMS. So 3 points that I would say to someone considering Smart TMS would be, is it for you? I mean, you have to do your research like I did. You have to work out on your own and with help that's provided, in that contacting the clinic, talking with psychiatrist Dr Neal or any other member of the team that can give you information. I would say you've got to make sure this is for you. You've got to, like I did, I had to bear in mind the cost. I had to bear in mind the time I needed off work, and other logistical things. All I would say is completely insignificant to the result, to the fact that I needed to do it. I would say you've got to factor in how much you want this problem solved. So the 3 points that I would say to patients who are considering Smart TMS would be, is it eligible for themselves? Have they done the right research? Have they spoken to the right people? I would say Dr. Neal, in my case, Dr. Neal at Smart TMS was exactly who I needed to speak to. The third point would be considering how much more of my life do I want to spend depressed, and do I want this problem sorted? You know, like spending the last 10 years having this underlying depression. I did not want to continue on for the next 10 years still having this depression. So that would be the three I would say. I mean, for me, the third is most important. How much is your life worth? I had to think about that quite a lot, and I came to the conclusion life is very precious. I didn't want to spend any more time having clinical depression, and also going back to doctors, going back to continuing to get more and different medication. I certainly didn't want to do that either, and TMS has allowed to not pursue that route, which I'm incredibly grateful for. Yeah.
Thank you very much. Thank you for doing that.
No problem.